But first we're going to talk about runner's knee. That's really common. You even said something really interesting about, I wish they'd do a PSA, public service announcement, about runner's knee. He told me that in the commercial. Tell me why, Phil.
Well, one, because it's so common. We see it very often in our office. And two, it is pretty avoidable if you do certain things. If you start feeling the pain coming on, you can kind of modify your activities. But let's talk about anatomy here real quick. So here we're looking at the knee. Here's the patella. These are the ligaments on the side of the knee. And what we're talking about here is basically an irritation of the cartilage underneath your kneecap from either from the running, excessive kneeling. There's different factors that can cause it, but that's what we're talking about today.
All right, so first of all, how is this different from arthritis? Is there a difference?
So in this situation, what we're talking about is more of an irritation of the cartilage, not necessarily a breakdown. When we talk about arthritis, we're talking about loss of cartilage. Unfortunately, this can lead to repetitive injury to this area, can then lead to arthritic changes or a loss of that cushion. But in this situation, what we're talking about is more of just an irritation of that spot.
All right, so the cartilage, obviously you're not really losing it, which happens with time. It's just irritated because maybe of the demand?
So the irritation can be from a couple different things. It could be from if, let's say, you don't have proper flexibility, then the mechanics that are pulling on that patella as you run, it could be off, which means you're rubbing one side of the patella versus the other. So that could lead to it. If, let's say, there are other factors like your arches in your feet can also put more pressure in that spot, your body weight. So there are different factors that can lead to that irritation.